So it's my pleasure to welcome today Liz Marrow, who's the Picton Library's manager, Kate McIntyre, who is here from Dementia Friendly, who is the Dementia Friendly Program Coordinator for Alzheimers New Zealand, and Diane Tolley, who's the Dementia Friendly Marlborough Coordinator. And we're going to start this afternoon with Liz is going to talk first, and then Diane, and then Kate is going to summarise at the end. And then we will have some questions if there's time. If you do have some questions as the webinar progresses, please pop them into the chat and we will try and get to them as we move along. That would be great. So Liz, I'm going to hand over to you.
Thank you. Kia ora, everybody. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko Taranaki, me monga whao te monga. Ko Kapuni, me tōtura nui te awa. No Arangi, no ko te rana, ano hoki aku tipuna. I whanau mai a hou I tamaki makauro. Ko Waitohi taku kainga I Naianei. Ko Ngāti Pakiha te iwi, ko Liz Marrow taku ingoa. Hi and welcome, and thank you so much for everyone for coming. Right, let's get on with this. Okay, the new Picton Library and Service Centre, Wharematauanga, was opened officially in June 2018, and I have been here since September 2020. The Marlborough District Library's strategy states that we provide experiences, inspire curiosity, enrich lives, empower communities. We provide experiences, technology, information, ideas, stories, and spaces for learning, engagement, and creativity with access to the digital world anywhere, anytime. And underpinning that is 4 basic focus areas. So how do those focus areas apply with the Working Towards the Dementia Award? Focus 1, we upskill our team members by becoming Dementia Friends. Focus 2, learning through conversations with carers and people living with dementia will enhance understanding. Connecting communities, again, through learning, discussion, and regular meetings, such as our afternoon teas and our shared reading groups. Inspiring readers. The shared reading groups not only enhance the people's memories, but provide opportunities to reconnect with literacy and create connections. Dementia is one of New Zealand's most significant and growing healthcare challenges. At the moment, nearly 70,000 Kiwis have been diagnosed, and with the baby boomers all getting older, that number is expected to almost triple by 2050. The Picton Library began the journey towards working towards Dementia Friendly way back pre-COVID times. In those days, Helen Devlin was the Picton Librarian, and on her retirement, she passed the mantle to me. But Diane Tolley, who will be talking later, she was the real catalyst behind this. My own journey began in 2012 with a close family member who was diagnosed with vascular dementia. And this experience made me really aware of the cruel aspects of this disease, as well as giving me a unique insight into how it can radically change people and families. When I was at South Taranaki District, I underwent training as a facilitator for shared reading groups. And I saw those when I was at the Willett Conference in Athens in 2019, and I was inspired to learn more. Here they're run in New Zealand by the Reading Revolution, who are in Auckland. So in Eltham, we had these weekly, and during the first lockdown, we had them virtually. And also as part of my experience in the Eltham Library, we were one of the original libraries who took part in the LIANZA Dementia Friendly reading groups. So when I arrived here in Picton and was asked to continue the journey towards working towards being dementia friendly, I was able to draw on these aspects from my life to assist us moving forward. So back to Picton. Diane visited the team meeting to explain what Dementia Friendly was all about and assisted all the team members to become Dementia Friends. She worked with the Picton team and the team at the District Library with full support from my boss, Glenn Webster, the District Library's manager. Diane has also been working with the Marlborough District Council Customer Services team in the main council building. And MDC have undertaken to highlight their commitment to dementia-friendly awareness in our staff policies and handbook. So we work towards meeting the dementia-friendly standards. These standards are outlined on the website and in the toolkit, which I'll talk about later. The important thing is to have a plan and evidence of the plan in use. So keep any email evidence as well as feedback from any activities you might run. Conversations began with the local Marlborough Alzheimers organisation, and from that the regular monthly Alzheimer's afternoon teas commenced. And this particularly provides a safe space for people living with dementia to interact with each other, as well as to ask questions, learn and connect with representatives from Marlborough Alzheimers. These sessions are run by Marie Patchett, who's the Community Outreach Officer at Marlborough Alzheimers. In Picton, we've also now have the company cafe, which is a way for all, but especially those most isolated, lonely or in need, to come in and chat, have a bite to eat and a cup of coffee or tea, and discover new friends. Some of these people have then discovered the connection that leads them to attend the more targeted afternoon teas. And we use the toolkit. Now, this can be downloaded from the website and it is incredibly useful. It outlines everything that you need to know, what you need to do, and how to do it. And there are templates to assist you on the way to accreditation. Working through the toolkit, we then started the road towards gaining recognition. Then COVID hit and Helen retired. So in November 2020, we started again. Handy to note that there are 2 levels of award. There's the working towards being dementia friendly, and we're proud to be dementia friendly, the Dementia Friendly Award. The working towards the one is the one that we have in Picton, and yeah, so it's for 2 years initially, and we're working beyond that to maintain that level of engagement. The Dementia Friendly Award requires building and physical environment conditions to be met. And an audit team, which includes a member who is living with dementia, come and inspect the building and the layout. So I would suggest if you're planning a new build over the next few years that you check the requirements and consider them while planning. Picton is a newish building and possibly could have benefited from some of these being considered at the time. Contact your local Alzheimer's organisation. If you're unsure of who that is, go onto the Alzheimer's website and all the local groups are listed there. Make a plan. We've been really, really lucky. Diane has been a massive help for us and for the District Library. But with also the shared reads that I've been able to start, one with our local care home and also another with the Marlborough come down from Blenheim once a month, and also through the experience gained with the LIANZA Dementia Friendly reading groups in South Taranaki. That's all helped to continue the conversation and to establish and nurture relationships with both our local organisation, but most importantly, with the attendees and their carers. For instance, at the initial read with the care home, one of the ladies said we were reading a story about 2 boys who steal a horse. And she went, I've just had a flashback. I remember learning to ride bareback as a child. And another, when we were reading a book about a lady who finds the Holy Grail in an op shop, we had a huge conversation about things that we found op shopping, which is a wonderful way that the ladies from Blenheim in particular really love to spend their days. The feedback I get from Marie and from Kelly, as well as the attendees, is always positive. even when someone gets emotional, which happens with the memories that surface. It's really important to remember that these reactions are because there has been a connection made. So finally, after 2 years from the initial discussion between Diane and Helen and Glenn, we received our certificate from Kate McIntyre, Dementia Friendly Coordinator for Alzheimers New Zealand, at the monthly Alzheimer's afternoon tea. Pictured are members of the community: Diane Tolley, Catherine Hart, who's behind Diane. She is the manager at Marlborough Alzheimers. Kate McIntyre, myself, Glenn Webster, the District Libraries Manager, and Wendy, Pauline and Kimberly, members of my team. It's really important to note that this is a constant work in progress. As libraries are a reflection of their whole community, so are our communities growing and changing the library. So what's next? COVID-19. Basically, we're having our next shared read with the Marlborough Ladies Group will be virtual, again here on Zoom. And I also will be talking to their carers later in October regarding facilitating shared reading groups. Dementia Friendly collection. Now, I'm not sure if you can see me, but we've started a new resource for Dementia Friendly. We're using a forget-me-not as an identifier, and we've started with the adult picture books that are designed to encourage memory and reminiscence, things like shopping in pictures and the garden in pictures. They're great. The sensory hour. This will be when lights will be dimmed, computers will be limited, and no other programs will happen. And it's hoped that eventually will coincide with our local supermarket and their quiet hour. Chance for people to quietly browse and absorb a calmer environment. And continue to build relationships through putting these and other things in place. It is anticipated that Picton Library will continue to lead as an example of a place working towards being dementia friendly in New Zealand. Thank you. I'll pass over to Diane now.
Diane, I think you're on mute. You might just need to unmute yourself.
Oh. Is that better? Kia ora. Tēnā koutou, tēnā koutou katoa. Ko Tongariro te Monga, ko Wanganui te Awa, no Taumanui aho, ko Diane Tolley toku ingoa, no reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you, Elisabeth, for all those kind words. It was quite difficult for Elisabeth to come in and have to take over when Helen retired. And then we'd had COVID in between, I think. So it was a bit of a challenge, wasn't it, Elisabeth, for you to come in? But you came with so much background in terms of dementia and having had your reading group experience, your shared reading in Southern Taranaki was, I think, was pretty helpful to you. Now, I'm currently the facilitator for this year for the Dementia Friendly Melba project. It's funded by a grant from the Office for the Seniors, and it's about connecting communities, creating communities where people living with dementia can continue to be engaged. And currently I've got 10 organisations, businesses that I'm working with. Well, I did have 10 before this latest lockdown. So I've just been contacting them all to see when they want to get started again. Yes. So Elisabeth's an inspiration, I think, for anybody, and a motivation for anybody who's thinking about undertaking this project, because she's really got into it, boots and all, and well done for doing that. And can I just say just now that not Picton Library, the Melba District Library has just been recognised as working to be dementia friendly. So that's a big achievement, because like Picton Library, we started at the same time and we had to go through COVID once. and then pick up again. And thanks to Jane Robinson for keeping the program going, and for Glenn for his support as well. So well done, Marlborough District Library. Some things to do, just a little bit about the program itself. It's unique to every business or organisation, so you don't all have to do what Elisabeth's done. You might take a slightly different slant on it, though she has lots of good ideas that you might want to pick up on. So we tailor it to meet the individual needs of organisations. So some of the attributes of successful organisations, that they're committed to making their services more accessible to people who are living with dementia, and they understand the needs of those people. So the facilitator can assist with this by providing awareness education sessions for people to become dementia friendly. So you don't have to do the online. Sometimes people do choose to do the online if they're unable to get to the face-to-face session. Providing examples of templates that may be used to gain customer feedback, which is part of the program. And the facilitator, if you're doing the becoming dementia friendly, they can help you with the physical review of your premises. And even if you're doing the working towards, you can still have a look at the physical environment as well as part of that. Some of the things that have come across in terms of the lead person or the lead team that are pivotal to the success of the program. So their role entails setting aside time to meet with the facilitator, which is really always very helpful to me to see where you want to go to, and to work out timeframes as well, because for every organisation, their timeframes are different. You've all got different commitments. And for some people, they get through it quite quickly, and others take quite some time. And promoting the program, this is the job of the lead team, promoting the program within the business or organisation, and Elisabeth does that extremely well. Keeping the momentum going. Sometimes it becomes quite difficult. You get a wee bit bogged down in other day-to-day business, and to actually keep the momentum going sometimes can be a wee bit difficult. So that's your role as well. And embedding the principles around what it means to be dementia friendly in the culture of the business or organisation. Because when we go leave you, we expect it to be able to continue, that the dementia friendly work continues on. And like Elisabeth said, she's got some ideas about what she's going to do in the future with her Century Hour and I'm sure she's got lots of other ideas in the pipeline as well. So it's not just a matter of saying, okay, we've finished this, let's move on to the next thing. It's actually keeping it up, and sometimes that can be quite difficult, can't it? But anyway, well done, Elisabeth, and well done to the Marlborough District Library as well. So thank you. And I'll pass it over to Kate now.
There we go. You can see my slides now. Yep, great. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko te matapeak te maunga, ko ngaro roro te awa, no raukawa aho, ko McIntyre toko whānau, ko Kate toko ingoa. Kia ora tātou. Thank you so much for the opportunity to take part in this webinar today. Our sincere gratitude to LIANZA for inviting us to take part and to share with you a bit about our national programs and how your library might become dementia friendly. My name's Kate McIntyre. I'm the Dementia Friendly Program Coordinator for Alzheimers New Zealand. Just a kind of bit about, to set the scene, our goal, our vision, our mission is a dementia friendly New Zealand. It's a big goal, obviously. Once the team of 5 million have dealt with COVID-19, we want them to all move to becoming dementia friendly. And our Dementia Friendly Recognition Program is one of our flagship programs that help us to build that Dementia Friendly New Zealand. And a Dementia Friendly New Zealand, as we see it, is a New Zealand that's kinder, that's more inclusive, more supportive and understanding of people living with dementia. A New Zealand where we challenge the stigma that is associated with dementia. We challenge and correct the myths and misunderstandings so that people living with dementia can live their best lives possible. It's interesting because dementia is a topic that's important and affects so many of us in New Zealand. You saw the numbers that Elisabeth was talking about. 4 out of 5 of us, that's 80% of us, know or have known someone living with dementia. That is a lot of us. If you think about 80% of the people on this call, that is a lot of us. So often when people think of a person living with dementia, they imagine a person living in a secure care setting, but actually 70% of people with dementia in New Zealand live in the community, and they want to be able to access the same facilities and find those facilities accessible when they want to go out into the world, and they want to be able to do and enjoy all the things that we want to do and enjoy. Libraries are community hubs, and so it's really great to celebrate Picton's achievement and following hard on their heels Marlborough District Library's achievement, as Picton is the first dementia-friendly library in the country. And it's really great to see such interest from libraries across the country. We're currently in conversation with at least a couple of other sites and keen to make my work week super busy and talk to all of you in the coming weeks. So who are we at Alzheimers New Zealand? We work nationally and we're an NGO, a charitable organisation to support people living with dementia. And we support local Alzheimers New Zealand organisations throughout the country. There is also another national organisation, Dementia New Zealand, and in each region in the country, there's either an Alzheimer's or a dementia organisation in your region. So for example, in Auckland, it's Dementia Auckland, and in Marlborough, it's Alzheimers Marlborough. So across the country, there is a local organisation that provides specialist support and expertise and skills for people living with dementia. At a national level, we run national programs. We also lobby government, trying to hold them to account for and advocate for the rights of people living with dementia in New Zealand. A bit about dementia. Some people believe that it's inevitable that we will develop dementia as we age. But actually dementia is not a normal part of aging. Just because you're getting old does not mean that you will develop dementia. However, as you age, your chances of developing dementia increase. And as Liz mentioned earlier, we've got this big bulge of baby boomers who are hitting later age in life. And so we're going to see increased numbers of people with dementia because we've got increased numbers of people in that age group. There's also early onset dementia. Dementia can be caused by a range of conditions, and so it's kind of an umbrella term for conditions that affect how well our brains work. And there's actually about 100 different types of causes of dementia. The most common form is Alzheimer's disease, and other more common forms are vascular dementia, Lewy body dementia, and frontotemporal dementia. Anyone can get dementia. None of us are necessarily safe from it. And the symptoms don't just relate to forgetfulness and memory loss, but actually each person's experience of dementia is unique to them. And so how they're affected is unique to them. And that makes that's one of the things that makes grappling with dementia a challenge, because there isn't a standard kind of way that people are when they're living with dementia. But the symptoms that we see include changes in memory, but also changes in thinking, behaviour, personality and emotion. And dementia is progressive. At the moment, there's no known cure. These changes affect a person's ability to perform the tasks of everyday life that we all engage with, And so if we as a community can support people to be more able to engage than they might otherwise be because of the impact of the dementia, then that's got to be beneficial for all of us. And also, if you are worried about yourself or anyone you know, we recommend that the best place to start is to talk to your general practitioner or your family doctor and get some advice. As we said before, the impact of dementia is significant. Every 3 seconds, someone in the world develops dementia, and already 60% of people with dementia live in low or middle income countries, but by 2050, this is going to rise to about 71%. Here, around 70,000 Kiwis are living with dementia now, as Liz said, and this is expected to rise to almost tripling at 170,000 by 2050. There are significant costs. That's a lot of money. And it's one of New Zealand's most significant healthcare challenges. There is good news. There's a lot that we can do to reduce the risk of developing dementia, or if we have dementia, to keep ourselves well and engaged and look after our brains. So the first piece of good news is that if you already got the look after your heart messages, then looking after your brain is taken care of to a degree in that. So things like eating a healthy, balanced diet, keeping active, managing blood pressure, not smoking, managing weight, those are all beneficial to your brain. Keeping active, checking your hearing. That's interesting that hearing is associated as a risk factor for dementia. And so encouraging each other. It's interesting, there's a lot of stigma about getting hearing tests still for some people. People are not confident, so getting people to have hearing tests and getting their hearing aids if they need them. Staying socially connected, loneliness and isolation are significant risk factors for dementia. And so a dementia-friendly library, a hub that makes people feel welcome and included, that people are able to access, is so important to help in this way. And the things that Liz described, like a cafe where you could go to your library and know that you could sit down, you might have a cuppa and something to nibble on, you might have a chat with someone, but there's no real pressure with that. It just makes the whole experience more accessible and more inviting for people. And you may have seen recently avoiding knocks to the head. Sports like football and boxing and other sports are coming into the spotlight around dementia. And also, just like the rest of us, doing things that you enjoy is good for you. And we all know that, but it's good to be reminded, and it's good to have permission as well. So our dementia-friendly programs. As I said, we want to create a dementia-friendly New Zealand, and underneath that bold and lofty goal, we have 3 programs in place to support that aim. So first of all, there's Dementia Friends. Dementia Friends is an education and awareness raising program module where people can work through about a 20-minute online module or do a face-to-face session and become a dementia friend. They start learning about dementia and start learning about how they can help people with dementia. Our Dementia Friendly Recognition Program is the program that Liz and Picton Library have worked with us through. This is an accreditation and recognition program for organisations that are interested in achieving formal status as dementia friendly. And then dementia friendly communities is really working with councils. Many councils are doing age-friendly work, and we're really keen to see councils incorporating dementia friendly into that dialogue and looking at what are the people in each community telling them will work for them to make the community more of a dementia friendly space, more accessible and achievable with them. So Dementia Friends. I've just picked some photographs of some of our most recent Dementia Friends. We're just about to hit 12,000 Dementia Friends. fast approaching 12,000. And the Dementia Friends education module is great for an organisation involved in our recognition program, because you can ask all your staff to get online. Everyone's much more comfortable with living in the online world now that we're living in the world with COVID, and become a dementia friend. And then, you know, as an organisation, as a library, that all your staff, any volunteers that you work with, are all have the same baseline level of understanding and engagement underway. And then you can build on that, perhaps with some education that might help with questions that specifically come up for the staff working in your library. Just as examples, when people do the program, they get a certificate, and you can see one of the locals, Alex from Nelson, and he's holding a framed copy of his certificate and wearing his badge. Alex is a real estate agent, and he decided that with every house sale, he wants to make a donation to his local Alzheimer's organisation. So just a wonderful way for someone to engage. Equally, just becoming a dementia friend, perhaps wearing the badge or wearing the wristband. You can see Luke in the orangey yellow jacket has got his wristband on display. Just wearing that can encourage people to feel confident, perhaps to approach you and ask for help. And we had one of our board members actually passing through Wellington Airport who was stopped by a member of the public who said, look, I'm really worried about my wife. What can I do? Also, you can see a group from Burwood Hospital who are school leavers with disabilities who have all become dementia friends as part of the program that they're working through at Burwood Hospital, and members of Driving Miss Daisy's team. Driving Miss Daisy's been an organisation that's been very supportive of the program. So that's Dementia Friends. And then the Dementia Friendly Recognition Program. This program, just some examples. We've got Picton down in the bottom of the screen, but we've also got our audit team with Diane and Heather Lackner from Alzheimers Nelson, Carol, who lived with dementia, and Jen, who were part of our audit team when we were auditing the public trust in Nelson and Marlborough, Nelson and Marlborough, and they're awarded with the Dementia Friendly Award, those two customer centres for public trust. We've also got across the top from facing on the right, we've got our Chief Executive, Catherine Hall, in a lineup of 4 people when we were down recognising Burwood Hospital as our first hospital in the country to become dementia friendly earlier this year. In the middle is Wesley Community Action, a local Wellington organisation that's become dementia friendly, and to the left, Te Manawa, which is museum in Palmerston North, became recognised as dementia friendly earlier this year. So just an example, we have a wide range of organisations involved. We have Westpac, we have organisations from the aged and residential care sector, quite a number of them. We also have the museum, libraries, hospital, and other organisations, and they're all listed on our website if you're interested to go and have a look. We're hoping to see a lot more libraries. Woohoo! And then dementia friendly communities. This photo is me taking a range of our resources and activities to a health and wellbeing day held by Ignite College in Auckland, but just like a really nice, amazing community group of students, staff, and even workers working on the site on contract all came along to take part in different activities. And really a dementia-friendly community, if we think about it, the kind of things that are dementia-friendly are things that make people feel valued, that make people feel welcome, and encourage them to be engaged. And so good signage, great physical design, documents that aren't written in size 8 CPI font with lots of curly swirly bits, but something that's written in something like Arial or Calibri, something, a good basic font that's about size 14 is much easier for people to work with. And actually, for all of us, it's better when things are clear and easy to follow and easy to understand. The core principles of being dementia friendly are how we've created our standards. So we have 7 standards that you work to meet in the Dementia Friendly Recognition Program. If you want to be accredited with the Dementia Friendly Award, if you want to achieve working to be dementia friendly, then you work to meet fundamental criteria across 5 of the standards. The standards are being person-centered. So rather than thinking, hey, let's get in a room, let's work out some great things we could do for people with dementia, and then let's tell them we're doing it for them. What we would encourage you to do is get in the room with some people who live with dementia in your community and their care partners and say, hey, what works well for you with what we do? What would you want to see? Would you be interested in something like a cafe club? Would you be interested in a reading session? What kind of books might you be interested in? So rather than us doing for people, it's a much more inclusive, and the voice of people with dementia includes and informs your work. And that means that a dementia friendly library in Walkworth or Nelson, Picton or Invercargill is going to look different in some aspects of what it chooses to do, because its community will be different and you'll have different priorities, but there'll be some common themes. So it's great that Liz is here to share her experience, and others can share their experience as they engage. Then we asked to look for commitment and leadership, and it's great to have Glenn, who's Elisabeth's manager, on the call, and so to see that commitment come through. But we want some kind of commitment from the organisation to be, and the leadership to be dementia friendly. We look at education for your workforce, we look at physical environment, we look at how you support your employees if they were to become either diagnosed with dementia or become the care partner of a person with dementia and need support and flexibility. We look at your published and information and website, and we look at your plan for the future. We want to engage you in a conversation and a kōrero that goes forward for the rest of forever in terms of what dementia friendly can look like, how it can grow and be maintained. We do a lot of other things as well. Dementia friendly is my purview or wicket, but you can see just some examples. Our website, people can go to our website, find out, we've got great information and resources, we've got the latest news, we've got ways that people can support, get involved, explore, or get help. Our Dementia Learning Centre launched towards the end of 2019, and it's offering more and more learning opportunities that are accessible to both people that work in areas related to dementia, but also, as an example on the bottom right, a Caring for the Carers program is launched, similar to Dementia Friends, where you can go online and work through it. We've also just recently run a brain health webinar, and we're also strongly focused on holding the government to account for the state of New Zealand's dementia services and what needs to happen to change and improve them. In September is World Alzheimer's Month, even though it's coming to an end. This Let's Get Moving for Dementia is our fundraising and awareness activity for World Alzheimer's Month, but anyone can get involved in that activity anytime, and you just go onto our website and click through and register yourself, and you can, any kind of activity is welcome, and we'd love to hear from you. And finally, the voice of people with dementia informs all our work. We have a person living with dementia who's on our board, who's on our accreditation committee for our recognition program, and we have an advisory group of people who live with dementia and their care partners who inform our work. And so we work very closely in partnership with them. And this quote, I think, is a really nice way to finish. I can reassure you that however it may feel at the beginning, it is still possible to live a life of quality with dementia. Not the life you had before perhaps, but a life full of promise. And I think that dementia-friendly communities, dementia-friendly libraries are all going to contribute to somebody being able to live their life to its fullest potential. So let's get your dementia friendly journey underway. I look forward to a bombarded email inbox and also some really fascinating questions from everybody there. So thank you, everyone. And I'll hand the screen back.
Wonderful, thank you. Thanks so much, Liz. And there's been a few questions in the chat, which we might have time to get to, but I just wanted to follow up what Kate said, that if you have any questions, yeah, do bombard her inbox, and I'm sure she'll be happy to support other people on the journey towards becoming dementia friends or working towards a dementia friendly workplace. I'm happy to open the floor. We've got about 15 or so minutes. We can work through some of the questions in the chat, but if there's something that somebody would like to ask, I would just encourage you to unmute yourselves and ask a question and who you are addressing the question to. That would be great. Does anybody want to be brave enough to unmute themselves and ask something? It's a friendly audience, and I'm sure if you ask a question, it will probably be something that somebody else is wondering as well.
I'm not going to ask a question. This is Katie from Walkworth Library. I just wanted to say we're very new on this journey. We just started out just as lockdown hit us, and Kate has been a mine of information for us and really helpful, and so has the toolkit. So yeah, just very new on it, but quite excited to get back into the library and start our journey.
Oh, that's wonderful to hear. So Picton and Walkworth on this journey. So I'm sure there will be some interesting conversations backwards and forwards. There were a couple of questions in the chat, mostly about wanting to know, where do you get a list of dementia-friendly books? And I'm sure that's not an easy answer. I do understand that the National Library have begun some work around their dementia-friendly book collection. So I can follow up on that and see whether we can share some information around that. But Liz, did you have something that you would like to share about books?
Yeah, for a few months back now on the listserv, Rotorua Library compiled an amazing list, and I'd encourage them, if it's possible, to share that out. Well, we've just started ours, and these are the ones we're using. We got them through Wheelers, and the series is pictures to they are called Pictures to Share Community Interest Company, which is a UK based one, but we had these in South Taranaki, and I think they're about $20 each. There's quite a large range, and they're great, specifically written and designed for people who are living with dementia.
I can speak on behalf of Rotorua Library.
Cool.
So yeah, we're doing some quite exciting things here with regards to supporting people with dementia and those caring for people with dementia. And we've developed a dementia collection, which is a standalone collection that sits alongside our large print collection, and it brings together information about dementia from our non-fiction section, pictorial type books, those books that are written specifically for dementia readers, and some of the books for children on understanding, you know, maybe why grandma is having trouble with certain things. So we've brought together quite a holistic collection of material in that collection. We've also developed a Pathfinder, which is a handout that people can take away with information, books, magazines, websites, community groups, and so on. I understand one of my colleagues was doing some work towards becoming dementia friendly, but reached a stage where she understood there was a cost involved. So I was just wondering if that was correct, if when you get to that audit stage, there is a price to that.
so probably best if I answer that. So with the two options, if you want the Dementia Friendly Award, which involves accreditation, we conduct an audit. We come and do an on-site audit. And so we charge a cost recovery fee for the time or the costs associated with the external third-party audit auditor that we get from the agency that we contract to in the program, so that the program has audit rigor in how it's organised. And obviously, if we didn't do that, if we were, as we grew the program, we would go broke quite quickly because we pay to access it. But working to be dementia friendly, there is no charge. So there's two options. Both have value. One was for organisations that want formal accreditation with the award, and the other is for organisations that want recognition as working to be dementia friendly. For both achievements, you get a frame certificate and you get collateral that you can use in your signage and display to acknowledge that you have achieved whichever level of recognition it is.
Awesome.
Status.
That's really good to know.
And
the other thing I just wanted to share is University of Tasmania, they have a Wicking Centre which runs free learning programs about dementia. There's one that starts next week called Preventing Dementia, and there's another one starting early next year that's Understanding Dementia. I just completed that one this week, and I really recommend doing that if you can. They're free courses.
And we would endorse those courses as well, and also add that we now have launched a New Zealand Dementia Learning Centre, and so keeping an eye out for the webinars and the activities that they're offering is also a great idea, because of course there are some differences between New Zealand and Australia in terms of our countries and our cultures, and so it's great to see a New Zealand organisation up and running too in that space. Joanne.
Cool. Thank you.
And I wondered if it would be helpful to just explain Diane and I and how we supported Picton, but also how we might support you, because unfortunately we're not able to clone Diane and send her all around the country. So as Diane, when you started this journey, Diane, you were the manager of Alzheimers Marlborough? Yeah. So Diane's now working with this Community Connect grant with a number of organisations across Marlborough to help them achieve working to be dementia friendly recognition. And my role is to support anyone, anywhere across the country, any organisation that wants to become dementia friendly. And so for supporting your organisation, what we're keen to see you do is build a relationship with your local Alzheimer's or dementia organisations, so that you might have some of their materials available, you might have them come in and do education for you. But if they're not able to do that because of workload or other demands, then it's my role to come up with ways that we can still support you to achieve the requirements of the program. So I'm available if you have a read, if you've got questions, we can sit down and, as Katie and I did, Katie and Gillian from Walkworth, just sit down and have, you know, an online meeting and talk through all your questions. And so this criteria, how might we meet it? And we can work it through, and I can give examples of what other organisations have done. And we although it's an audit program and it's got rigour, we also are the friendly auditors, so we're not coming to find failure when we come to see you. We're coming to either celebrate your achievement or look for you to showcase what you've done with the conversation. And I should also say, for working to be dementia friendly, the requirement is that you send in, for either program, a self-assessment once you've done an action plan to meet our standards and criteria. And then we evaluate that. And if we think you're ready, then we recommend that to our accreditation committee and they make the decision. If you want the award, there is a fee, so I can tell you about the fee if that's something that you want to explore. We do try and keep it very reasonable. We don't clip the ticket in any way, but you send in your self-assessment. We agree that you're ready for audit. We invoice you. Once we receive payment, we audit you. The audit report goes to the accreditation committee and they make the decision. And then whichever form of status, whichever option you choose, it's for 2 years. In 2 years' time, we ask you to send us an updated self-assessment. What have we done since? What have we built on? Every 2 years, that's what we ask for the working to be dementia friendly. Every 4 years, if you're in the award program, we would ask to audit you again.
Thank you for that, Kate.
Thank you. Did anybody else have any other questions they would like to ask? We've got a little bit more time. I really liked what you said, Kate, about starting with your community. So there's not a sort of a cookie cutter approach to this. It's really having conversations with people in your community about what it is that they would like their library to be doing. Such a powerful way to really understand right from the beginning who are the beneficiaries of the work and what are the outcomes that you're wanting to support through this work.
Yeah, absolutely. Our first standard is about being person-centred, and there are 3 criteria in that standard. The first one is that you have a relationship with your local Alzheimer's or dementia organisation, which means you're connecting up with the experts in your community. And it also means that if you're worried, if a customer comes in and says, you know, gosh, I've just been to the GP and they've told me my husband's got dementia or I've got dementia, you could be saying, wow, that's a pretty big thing to deal with. We can put you in touch with the local expert organisation so your staff would kind of know and feel comfortable to do that. And then we ask you how you've listened to people with dementia and taken on board their feedback in your services and what you do. And often an organisation, I'm not talking about a library necessarily, but we'll say, oh yeah, we do a satisfaction survey every year. But for people with dementia, satisfaction surveys are often very inaccessible, whereas sitting down in a relaxed kind of frame, having a bit of a korero, having a cup of tea, and asking a few questions about what works well, what could we be doing differently, what would you like to see, what do you struggle with, and then taking that information and using that to inform your work going forward is what we're really looking for.
Yeah. I just wondered if you could comment, Liz, when we did the work on the Dementia Friendly book groups last year, and we have another webinar coming up on that on Friday about facilitating Dementia Friendly book groups. One thing that sort of struck me quite strongly was it's not so much being worried about what is the book that you're going to use, but using the book as a provocation for conversation and relationship building. Would you like to comment on that? Liz, you're muted. Need to unmute.
Yes, okay, sorry about that. Yeah, I completely agree. It is about, like, I tend to use the books from the reading organisation in the UK, which is short stories design, and I choose them literally for the range of ideas and things that could come up. And I agree, it is a connection that's made, like the lady who remembered riding her horses when she was young. There's another tale that we do called Faith and Hope Go Shopping, in which they literally escape from a care home, head off into London to look at some amazing shoes that are completely out of anybody's league and the experiences they have that day. And from that, I read that with my ladies from Blenheim, and they were just talked about the shoes they used to own, the things they got up to as youngsters, as teenagers, and Marlborough. And it was fascinating. So yeah, you're quite right, Anna. It's the connection. It's not necessarily the book or the story. It's just a means of facilitating that conversation.
Yes, and I do remember too, one of the things that came through quite strongly is making sure that you're not dumbing stories down, or you know, some people were sort of saying, you know, well, can I read children's picture books to people with dementia? Well, it was like, well, why would you read children's picture books to adults? These are adults who have huge life experience and memories to draw on. So about making sure that you're not babifying the content and letting the conversation go where it will, I think was the other very strong message that I got through. So while it's great to have a collection of dementia-friendly books, I wouldn't feel held back by that, because it's about the conversation and that safe space, people who are welcoming and understanding you, etc. Yeah. So in closing, I just would really like to thank you, Kate and Diane, for coming along and helping to create this LIANZA webinar. There's been a bit of organisation going on this week, bringing it all together. So I really would like to thank you so much for your time for doing that. And I hope that this has been really useful to people in terms of inspiring them to start looking at this going forward. I am almost a baby boomer, so I'm hoping that you're all going to be really great at this by the time I might need you in libraries. And to thank you, Liz, for your leadership in this area, and for being willing to take on this challenge of talking to such a large group of people and sharing your experience. I'm sure it's been really inspiring for people. And thank you to the people who have shared your ideas and let us know about what you're doing in your libraries. I think there's a lot to follow up on in this area, and so I hope I'm sure we will return to this topic of dementia-friendly libraries more than once over the next little while, and it'll be just so wonderful to see, you know, what you will do in the years to come. So thank you so much, and I will just close with a karakia. Anuhia, anuhia, anuhia ki te urutapa nui, kia wātea, kia mama, te nāko, te tinana, te wairua, I te ara takatā. Koia rā I rongo, whakairea ake ki runga. Kia tina, tina, huie, taikie. Thank you so much, everybody.